to get some perspective on this new twist in the Manning saga, I'm joined from CNN New York by Dr. Judy Kuriansky. She's a clinical psychologist and radio host. And, you know, doctor, I really hope you're able to help our audience really parse this.
Sure.
And this is a man, a person, now someone who wants to become a woman who is very troubled. In light of everything he has been through through WikiLeaks, in terms of giving us some insight as to why he would still choose to draw so much attention to something that is so personal, what is at play there?
Well, the term that is used for the condition that he's describing, she wants to be called Chelsea, remember, is gender dysphoria, and therein lies the clue to what's going on here. A dysphoria means discontent, means distress. A true person who is having that gender dysphoria and wants to change from a man to a woman, and sometimes there are women to men, have this feeling that I am born in the wrong body. Those are the key phrases that we listen to in the profession. There's a lot of depression that goes along before that, and there can be a lot of depression after that as well. I was one of the first people on the teams who were evaluating whether or not these people should have the operation because of this confusion of emotions, and some people regret it afterwards. And some people, by the way, Paula, do what's called stop before the chop. That means that they go through the hormone therapy, and for a man wanting breasts and wanting to change the voice and wear clothes and look and dress and act like a woman and be treated like a woman, but don't actually change their genitalia. So that is an important distinction that you were hearing the lawyer talk about when he said gender reassignment surgery in terms of the surgery as opposed to the hormone treatment.
Yeah, and I have no doubt that this was, a decision that she really thought long and hard about and has been really coping with for years. But why make it so public? If you want to give us some insight as a clinical psychologist, why? Why would she determine to do this after having been having been, as she says, been put through torture in the public eye already?
Well, exactly, because people who want this really want to be seen by the public. That's part of the diagnosis in the Diagnostic and Statistical Manual, that not only do they want to feel real, connected to the real body themselves, but they want other people to perceive themselves that way. Now, one of the most famous cases, as we well know, is Cher's son, Chaz Bono, who was born a girl and then became lesbian and then now is a man, Chaz, and wants to be seen by the world as a man. What's very interesting here also, and very important, Paula, to point out, from an analytic point of view as a psychologist, I'm saying now, and someone familiar with these cases, is that here is a person who was revealing secrets, documents from the government. Now, think about it. It's secrets. And that's kind of saying, I want to be the truth to be known here. And so this is the answer to your question. It's coincident for this person to be saying, I now want to be seen as a woman. I am a woman. Call me Chelsea, because the truth in this person's mind is very important. The truth for the government, coincident on an analytic basis with the truth for the person's own self.
Okay, incredibly interesting. Thanks so much for coming in to help us with this very sensitive issue right now. Thank you.